Delivering bad news is one of the most difficult and challenging situations, both in real life for doctors and in the exam. There's a 6-step protocol, SPIKES, which helps to remember important steps in delivering bad news to the patients. S is for setting up the interview. The aim is to get the physical context right. Maximize privacy, avoid interruptions to help patients listen and understand. Respect confidentiality and provide support. So it is important that you check to have all the information and available test results. Decide on the terminology that you are going to use and arrange for privacy. P is for assessing patient's perception. Finding out how much the patient knows, in particular how serious they think the illness is and how much it will affect them in future. You can ask questions like, what have you made of the illness so far? Or, what did Dr. X tell you when he sent you here? This will help you gauge how close to the medical reality the patient's understanding is, and it will tell you about pacing, although whether the patient is in denial or not. I is about obtaining the patient's invitation. In other words, finding out how much the patient wants to know. In any conversation about bad news, the real issue is not do you want to know, but at what level do you want to know? We can ask the patient that, would you like me to tell you the details of your diagnosis? Or, if it turns out to be something serious, are you the kind of person who likes to know what exactly is going on? The K part is for giving knowledge and information to the patient. The 4 important part is telling about diagnosis, what is the treatment plan, what is the prognosis, and support. Step 5 and E is addressing patient's emotion and empathic responses. Responding to patient's feeling. This is a difficult challenge in breaking bad news. Patient responses can vary from silence to distress, denial, or anger. Observe the patient and give them time. Acknowledge any shock and ask them what they are thinking and feeling. Listen and explore if you are unclear what the patient is expressing and respond empathically. Empathic reflection let the patient know that you have registered what they are conveying to you in words or body language. Whilst the patient is experiencing strong emotions, it is difficult to go on to discuss anything further, as they will be finding it difficult to hear anything. Allow silence. Empathy allows the patients to express their feelings and worries and provide support. Do not argue with the patient. Allow expression of emotion without criticism. The last step is about strategy and summary, planning and following through. Patients will be looking to health professionals for help in making sense of the confusion and offering plans for the future. Demonstrate an understanding of the patient's problem list. Indicate that you can distinguish the fixable from unfixable. Make a plan or strategy and explain it. Preparing for the worst and hoping for the best. Identify coping strategies of patient and reinforce them. Identify other sources of support for the patient and incorporate them. Invite questions. Tell them what happens next. When difficult questions come up, do not ignore them. Try to acknowledge patient's question and feeling and be honest about the answer. Try to keep the ball rolling to the things that you can do at the moment. So, as an example, when a patient asks, "Doctor, am I going to die?" You can say that I can see that this is a tough time and all sorts of questions are going to come out. But I will be honest with you, at this moment, I do not have the answer to that question just yet. But we can talk about other things that will be coming up that will allow us to get closer to those answers for you. Like we can do further investigation and we can do a referral to specialist.